Welcome back to Trots TV. It's time for the Doctors In. Dr Nick Kannegieter is back with me. Thanks for your time once again, Dr Nick.
Not a problem, Greg.
Something we see a lot in standardbred racing, in harness racing, tendon injuries. Yes,
it's unfortunately a very common issue, and if anybody tells you they've got a cure, they're either going to become very, very wealthy or they're making it up. We've tried over the last, well, I've been in practice 30 years, and we've tried everything that's available, and I still think that surgery is the best option. It might be because I'm a specialist surgeon, but I think if the surgery is done correctly, I think it's the best option. But tendon injuries, the first question is, people ask, is why do they occur? And if you've ever had the chance to dissect out a horse's leg, actually, we should have brought a leg with me. You find that the superficial flexor tendon, which is the main tendon that runs down the back of the leg, is about 1 centimetre wide and maybe 3 or 4 millimetres thick. So it's a tiny structure, but at any one point in the stride, it's taking virtually the entire weight of the horse, and at speed, there's a lot of pressure put on that tendon. And so, to me, it's more a surprise we don't see more tendon injuries than we do, because of the pressure that is put on this tiny structure, and it really is a very poor design. So, there's a lot of theories about why some horses get tendon injuries, and ranging from excessive heat build-up within the tendon, which seems like a bizarre concept, but may be true, to the more common theories of just straight overstretching and fatigue. As the horse gets tired, we tend to see more injuries in tendons. You know, later in the race, we see more than we see early on. And certainly you can't ignore knocks and bashes and things that can cause some initial damage to the tendon, particularly if it's under tension and they get hit. That can cause some problems. So, unfortunately, not knowing why tendon injuries occur makes it really hard to prevent them happening. The one thing that people always say is to build the horse up slowly. Don't suddenly go from come out of the paddock and go to fast work, in a week. Try and build that up as slowly as you can, because the tendon does build up strength as well. So the longer build up you can get, the stronger the tendon and the muscles around it are going to be, and the better support you might have. That's the theory. The other thing, of course, is to make sure you've got a good surface, and that's where, at least with harness racing, and particularly at Menangle here, you do have a very good surface that's even. It's in the gallopers, where there's holes in the track all the time, that can be a big problem. So make sure the track surface is nice and good for racing, so you can minimise your damage. So that's really all you can do, in terms of trying to minimise it. There's just nothing to stop it. So the next thing people say is, all right, well, my horse has got a tendon injury. What do I do about it? Is it the end of the career? Is it? Look, we've had some horses that have come back, particularly standardbreds, and have come back and have done extraordinarily well. And I travel a lot overseas teaching, and go to places and doing surgery things in places in Asia, Macau particularly, and Turkey, which has got a huge racing industry. Okay. Not so much standardbreds, more Arabians and thoroughbreds. But you see some horses there with just appalling tendons that just keep going round and round and round. And standardbreds can do that to a larger extent than perhaps other breeds. Because I think their gait is more inducive to them coping with a tendon injury. So it's certainly not the end of the world. In some cases, you can manage it, and you can get quite a bit of healing with those. One of the things that people will often resort to is topical medications. Makes absolutely no difference. Absolutely no difference. I mean, in the bad old days, we used to, of course, pin fire and blister everything. Makes no difference. There's been a lot of studies done to show that none of those things get anywhere through the skin. They don't even get to the tendon. So all you're doing is causing a lot of inflammation for no benefit to the tendon, giving the horse a rest, and the rest is what's going to be helping the horse. So, those sort of things, those old-fashioned treatments are well and truly gone. Stem cell an option? Well, these are then the newfangled treatments that people are looking at, and stem cells are very much at the forefront of that newer technology. I think with stem cells in many species, and horses in particular, we're probably still maybe 20 years away from knowing how to use them and getting results, clinical results with them. You look at any racing journal or veterinary journal, and there'll be ads for stem cells, different types and different sources. Initially we got stem cells from the sternum, from the sternum or from the hip. So we got these cells from there and injected into the tendon, and then eventually they were cultured, and so you got a concentrate of stem cells, and they were injected in, and then you can get stem cells from the fat around the tail or from the ligament in the neck. There's all different sources, but nobody's really been able to come out and show they actually make a big difference. If you get one horse and you inject it in and it comes right, people say, oh, the stem cells did it. But you need to look at 100 or 200 horses. So look, we injected 100 with stem cells. Here's 100 with similar lesions without stem cells. What were the results? And the data to currently suggest there's not much difference. So you can spend a lot of money on something like stem cells and perhaps not get the return. But having said that, in certain lesions, in the suspensory ligament or in the core lesion of the tendon, I will still do a direct transfer of bone marrow from the sternum into the tendon in conjunction with surgery. And as I said at the beginning, I think that surgery is still the best thing for horses with recurrent tendon injuries or with a really severe tendon injury. And we cut the check ligament of the tendon, and the check ligament is a ligament that attaches between the tendon and the bone, and it actually is above the knee. So the tendon strain will be below the knee, but the check ligament attaches above the knee to this tendon. And so what we do is we cut that, and it becomes about 1 centimetre longer, and eventually heals back up, but it's about 1 centimetre longer. And what that does is that it takes a bit of strain off that particular tendon, the superficial tendon, and puts a bit more strain onto the suspensory ligament and the deep flexor tendon, which are bigger and stronger structures. And the way I sort of explain to people is that by doing this and making it a bit longer, it's got a little more elasticity to it. So instead of going from the tendon going from bone to bone to bone, so it's just a solid structure, there's more of it is in the muscle, so it's a lot more elastic. So it's like a bit of string, that if you pull that bit of string and suddenly stretch it too far, it breaks. But if you've got a bit of elastic and you pull it, it's got a bit of stretch in it, so it's less likely to tear and get damaged until you really pull it. And so I think the surgery does give a little bit more elasticity to the tendon and decreases the incidence of it bowing again.
What's success rate like?
Oh, well, in the big studies that have been done and the ones that I've done, we will get at least 70% of them back to the track.
Yep.
Yeah. The big question is, how do you define success? And to some people, getting them back to the track is success. To other people, unless they win the Inter-Dominion, it's not a success. So it's defining success is hard. But we find that probably 75% of these horses can get back and race up to their ability. Few of them will strain the tendon again at some point. Some of them strain the tendon in the other leg. Some of them are too slow anyway. So there's all sorts of things that count against it. But I think it's still a surgery that's worthwhile. It seems to have gone out of fashion a little bit. And I think because people are thinking, well, we'll go with stem cells or whatever. But I think that if it's done correctly, it's a good surgery. And one of the problems is there's a lot of fibres to cut. And unless you cut all the fibres, you don't get the right result. And it's a lot harder than people think. It's not the sort of thing you sort of read a book and get the kitchen knife and off you go. And even some surgeons, I don't think, do it properly. You've really got to be careful with it.
Ballpark figure, if an owner's out there and a horse got a tendon injury, what sort of money are we looking at?
Currently, probably around $2,500 to $3,500 for the surgery and the stay in hospital, anaesthetic, and the bone marrow transfer as well. So it's somewhere around there. It just depends a little bit on where they go and how long the horse stays in hospital. That's a rough ballpark figure for that.
All right, and how long off will the horses normally need?
Well, again, it depends on how serious the injury is, how long ago it's happened, what the program for the horse is. But some of these horses we actually do keep in work, just very slow work, because tendons heal better if they're under constant low-grade pressure and some bit of tension. And I often think that sticking them out in the paddock is possibly the worst thing for them. It's the easiest thing, but if you do that, you've got to be very patient, bring that horse back, because out in the paddock, that tendon's lost all its strength, and to get it back to the strength that it was can take a long time, and particularly with older horses. And a lot of horses with tendon injuries are a bit older, and you know, you put them out for 12 months. You know, it can be 12 months before that tendon is ready to face that strain again. And a lot of people don't give them that 12 months back in training before they race them, which is why a lot of them do strain again. But you know, it's only looking 2 years out of a horse's life, and if it does it when it's 5 or 6 years old, it can be 7 years old, you know, before it comes back to race, and that's one of the big problems with it.
All right then, Dr Nick, thanks for your time again this week.
Not a problem.
There he is, Dr Nick Kannegieter, talking about tendon injuries this week.